Hi there, this is Dr. Paul Firnhaber, and guess what? It's Wednesday and time for 10 minutes of truth. So today we're going to be talking about marijuana, cannabis, and pain. And there's been a lot of things in the news regarding medical marijuana and how good it is and how great it is and that it should be in use. So we're going to look at a study in the Journal of the American Medical Association Network Open that came out on November 1st of last year. So it's a fairly recent study. And the name of the study is Assessing Cannabis-Based Therapies for Pain. Now let's look at some of the key points of this article. First of all, this article was a meta-analysis of 20 studies involving 1,459 individuals. Here's the question they were asking. Do cannabinoids, which are the chemicals in marijuana, decrease pain? So in this study, in this meta-analysis, they looked at all these studies. Some of them use pills, sprays, oils, smoke, and vapor. Now, we understand that pain is one of the most common reasons for seeking health care. And I would say in my office, probably the most common reason people even come to see me is because they're in pain. And so medical cannabinoids are used to treat multiple pain conditions. And there's increased interest in using cannabinoids for pain, for musculoskeletal pain, although I think chiropractic is a much better option for that, and chronic pain like cancer. And so these studies looked at how well cannabinoids work for decreasing pain. And the bottom line is these studies did not show a significant difference between the genuine drug and placebo outcomes. It means that the people getting the placebo got just as good a results as people getting the cannabinoids. Now, why is that? Well, studies also show that reports in the mass media and lay press and internet information fosters treatment expectations, especially by exaggerated media reports with strong positive bias. So the media has certainly been on the side of medical marijuana and cannabis, and they're always touting how great it is, how good it is. But these studies show that the fact of the matter is that when they got a placebo, which could have been any oil or any pill or whatever they were using, that any spray could have been a vapor from anything, that the placebo worked just as well as the cannabinoids. So they're saying, the article comes out and it says, because of media bias, not associated with actual clinical outcomes, is influencing the science, policy, and regulatory decisions, which will be made on biased studies. Not going to be made on science, but they're going to be made on the bias produced by the media. And the media, the studies, show the placebo to be just as effective as the drug. So this shows how mass media bias can really affect science and can affect the outcomes of studies. And so when you have a very strictly controlled experiment, where you have very tight controls and no media bias, what happens is that people actually don't do all that well with cannabinoids. They do just as well with the placebo. Now, where have we seen this before? Well, we certainly saw it during COVID, okay? We heard all about the COVID vaccine and how great it was, and there's huge media push to force people to get vaccinated, when in the end, we found the vaccine did not work. People that were vaxxed and boosted still got COVID, sometimes multiple times. And now we're finding out that a lot of these people have it worse than people who were never vaccinated and have a higher chance of going to the hospital. We also see it in the cholesterol, statin, cardiovascular disease argument, is that statins marginally, just barely reduce cardiovascular disease, barely reduce the heart attack risk. There's almost no benefit at all for taking statins, and yet there's been such a huge push by the pharmaceutical industry and by the media that's pushing these drugs that people automatically think that there's all kinds of science behind it. And so what I want to say now is this. If you're thinking about using cannabinoids or medical marijuana to decrease pain, you might want to think about the fact that the studies really show that it doesn't work any more than the placebo. So, if you're having a lot of neuromusculoskeletal pain, you might want to try something like chiropractic, massage therapy, or some other manual therapy before you go to cannabinoids. And we're giving people a chance to do this in our office in our Patient Appreciation Week, which is coming up the first week in April, where we're going to be doing complimentary preventative health screenings to anybody who wants to come in and get one. We'll take 10 to 15 minutes out of our day at our expense and do a screening on you, talk to you about diet, whichever you'd rather have, and let you know if we can help you or not. This is a much better option than going to medical marijuana. So that's all I have for today. God bless you, and we'll see you again next week.